How can I keep my blood pressure from spiking for 24 hours? Is your blood pressure silently rising? Right now, blood pressure could be silently damaging your body and you wouldn't feel a thing. It's a process that can go on for years, quietly setting the stage for a heart attack or stroke. Personally, I take 2 blood pressure lowering medications and 2 cholesterol lowering drugs in addition to lifestyle changes. What about you? Would you like to comment? So how do you find this invisible threat before it's too late? That threat is high blood pressure, also known as hypertension. It's earned the grim nickname, the silent killer, for a very good reason. For most people, it has 0 early symptoms. No pain, no red flags, nothing to tell you something's wrong. You can have it for years and be completely unaware. It's a problem that builds up slowly, quietly, as your body gets used to the constant extra force of blood pushing against your artery walls. Think of your body's circulation like the plumbing in your house. Your heart is the pump, and your arteries are the pipes. Blood pressure is simply the force the blood uses to travel through those pipes. A certain amount of pressure is perfectly normal. It's how blood gets everywhere it needs to go. But when that pressure stays too high for too long, it puts a dangerous strain on the whole system. When you see a blood pressure reading, you'll always get 2 numbers. The top number, the systolic pressure, is the force when your heart beats. The bottom number, the diastolic, is the pressure when your heart rests between beats. Both of those numbers can creep up for years without you feeling any different in your day-to-day life. That is the silence, and that is the danger. It's a problem you can't feel, but one that's always working against you behind the scenes. While you're going about your day feeling fine, a storm could be brewing inside your body. This is the devastating long-term damage that happens when high blood pressure is ignored. It's not a sudden event, it's a slow grinding process that wears down your most vital organs. First up, your heart. It's a muscle. And when it has to pump against high pressure 24/7, it has to work way harder. And just like any muscle that's constantly overworked, it gets bigger and thicker. That might sound like it's getting stronger, but it's the exact opposite. A thickened heart muscle becomes stiff and inefficient. Eventually, it can lead to heart failure, where the heart just can't keep up with what your body needs. Then there are your arteries, the highways for your blood. High pressure is like taking fine grit sandpaper to the delicate inner lining of these blood vessels. Over time, this creates tiny tears and injuries. Your body tries to patch them up, but this can lead to a buildup of plaque, a nasty mix of cholesterol and fats. This is called atherosclerosis, or hardening of the arteries. As plaque builds, your arteries get narrow and stiff. If a piece breaks off and forms a clot, it can completely block blood flow, triggering a heart attack or stroke. Your brain is also in the line of fire. The same damage that happens to the arteries in your heart can happen to the ones in your brain. This can lead to disaster. A blockage can cause an ischemic stroke, starving parts of your brain of oxygen. A weakened blood vessel can just burst, causing a hemorrhagic stroke. And even without a major stroke, chronic high blood pressure can slowly choke off blood flow to the brain, leading to vascular dementia, which impacts memory, thinking, and even your personality. While we are in the middle of the video, if you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos. Blood pressure doesn't stop there. Your kidneys are amazing filters full of tiny blood vessels that clean waste from your blood. High pressure wrecks these delicate vessels, making it harder for your kidneys to do their job. Over years, this can lead to chronic kidney disease and eventually kidney failure. Even your eyesight is at risk. High pressure can damage the fragile blood vessels in your retinas, leading to blurred vision or even permanent blindness. This is what makes the silence so terrifying. All this damage to your heart, arteries, brain, and kidneys can be happening for a decade or more while you feel perfectly healthy. For most people, high blood pressure stays quiet. But in some cases, when it spikes to extremely dangerous levels, what doctors call a hypertensive crisis, the silence is shattered. It's critical to know that these are not like early warning signs. These are late stage, blaring alarms that your body is in immediate danger. In a crisis, you might get a sudden severe headache that feels like nothing you've ever had before. You could have intense chest pain, feel short of breath, or notice a pounding feeling in your chest, neck, or ears. Other emergency signs include sudden vision changes, dizziness, confusion, or trouble speaking. Unexplained nosebleeds can also be a sign. Let's be crystal clear. If you experience these symptoms, this is a medical emergency. It can lead to a stroke, a heart attack, or other life-threatening events, and you need to get help immediately. These aren't gentle nudges that something is wrong. These are sirens telling you a crisis is already happening. Waiting for these symptoms is like waiting for your house to be engulfed in flames before you think about buying a smoke detector. The goal is to never, ever let it get to this point. Okay, I know that was heavy, but here's the good news. The solution is simpler than you might think, and we're about to get to it. If you're finding this useful and want to learn how to take control of your health, this is a great time to subscribe and turn on notifications so you don't miss what's next. So, if you can't feel high blood pressure and waiting for symptoms is way too late, what's the answer? How do you unmask this silent killer? The solution is surprisingly simple, totally accessible, and it is the single most important step you can take. You have to measure it. The only reliable way to know if your blood pressure is high is to get it checked regularly. It's that straightforward. This isn't something you can diagnose by feel. It has to be confirmed with a number. The guidelines are clear. Normal blood pressure is below 120/80. A top number between 120 and 129 is considered elevated. Stage 1 high blood pressure starts at 130/80, and stage 2 starts at 140/90. Most doctors might say 130/80 is okay, that is wrong. Getting your numbers is easier than ever. You can have it checked at your doctor's office, and many pharmacies have free automated kiosks you can use. But one of the most powerful tools is monitoring your blood pressure at home. Taking readings in a relaxed environment can give you a more accurate picture of your true numbers, away from the white coat hypertension effect. That's when your pressure spikes just from being nervous in a doctor's office. When you check it at home, try to do it at the same time each day after sitting quietly for a few minutes. Keeping a log of those numbers is incredibly valuable information to share with your doctor. Knowing your numbers is like flipping on the lights in a dark room. It removes the guesswork and the fear of the unknown. It's the first, most powerful step towards stopping the silent damage before it even starts. Figuring out your personal risk can be a great motivator to get checked. While high blood pressure can affect literally anyone, some things definitely stack the deck against you. Some of them you can change, some you can't. Let's start with the lifestyle factors you can control. A diet loaded with sodium, which is hiding in most processed and restaurant foods, is a huge one. Too much salt makes your body retain fluid, which cranks up the pressure. On the flip side, not getting enough potassium from fruits and vegetables can also raise it. Being inactive is another major risk. A sedentary lifestyle often leads to weight gain and makes your heart work harder than it should. Being overweight puts extra strain on your entire system. And it's no surprise that drinking too much alcohol and using tobacco both directly raise blood pressure and damage your arteries. Then there are the risks you can't change but absolutely need to be aware of. Your risk naturally goes up as you get older. Family history is another big one. If your parents or close relatives had high blood pressure, you're more likely to get it too. Certain demographics are also hit harder. For instance, Black adults tend to develop high blood pressure more often and at an earlier age. Finally, other health issues like chronic kidney disease, diabetes, and sleep apnea can all contribute to high blood pressure. Recognizing these risks isn't about being scared, it's about being smart. Knowing you have a few of these factors is a powerful reason to be vigilant about getting your blood pressure checked. Taking control of your numbers is easy. Finding out you have high blood pressure isn't a life sentence, it's a starting line. The fantastic news is that this condition is highly manageable. With lifestyle changes, and if you need it, medication, you can lower your blood pressure and slash your risk of heart disease and stroke. The first line of defense is always your lifestyle. One of the best strategies is the DASH diet, which stands for Dietary Approaches to Stop Hypertension. It's packed with fruits that are not very sweet, non-starchy veggies, legumes, beans, and lean protein, and it's been shown to lower blood pressure as well as some medications. A huge part of this is cutting back on sodium. Aim for less than 20,300 milligrams a day, but if you already have high blood pressure, the ideal limit is closer to 1,500. This means reading labels and cooking more at home where you control the salt shaker. It is better to check the blood salt level before reducing, as some people may already have low salt levels in their blood. Regular exercise is non-negotiable. Aim for about 150 minutes of moderate intensity activity, like a brisk walk, a swim, or a bike ride, every week. Exercise makes your heart stronger and more efficient, which lowers the pressure on your arteries. If you're overweight, losing even a small amount, like 5 to 10 pounds, can make a huge difference. And of course, limiting alcohol and quitting smoking are two of the most powerful moves you can make. Managing stress with things like mindfulness, yoga, or just deep breathing can also help. For many people, these changes are enough. For others, medication is a necessary, life-saving tool. There's zero shame in needing medication to control your blood pressure. These medicines are safe, effective, and work to protect your body from long-term damage. Your doctor will work with you to find what's right for you. High blood pressure is called the silent killer because it can wreck your body for years without a single symptom. It wears out your heart, damages your arteries, and threatens your brain, kidneys, and even your vision. But the power to stop this silent threat is completely in your hands. The solution isn't some complicated futuristic procedure, it's knowledge. It's the simple act of getting your blood pressure checked. That one action trades fear for information. It empowers you to take control, to make changes, and to partner with your doctor to protect your health for years to come. So, the most important thing you can do after watching this is to go find out your numbers. Get your blood pressure checked, talk to your doctor, and please share this video with someone you love. It's a simple act that could genuinely save a life. These sudden spikes aren't just a minor annoyance, they can be a sign of an underlying issue that needs attention. Ignoring them could lead to serious health problems like heart disease, stroke, or even damage to your kidneys. Your blood pressure usually fluctuates throughout the day, but a sudden spike can be a red flag. If you're experiencing frequent spikes, it's essential to talk to a doctor to rule out any potential health concerns. Even if you're generally healthy, it's crucial to address these spikes, as they can still cause damage over time. Think of your blood pressure like a warning system. It's your body's way of telling you that something's off. Let's dive into the common causes of sudden blood pressure spikes. Stress is a significant contributor. When you're stressed, your body releases hormones like adrenaline, which can cause your blood pressure to surge. Certain medications, like decongestants or some antidepressants, can also lead to spikes. Caffeine and nicotine are stimulants that can rapidly increase your blood pressure. So if you're a coffee lover or a smoker, you might want to keep an eye on your BP. Acute pain, whether it's from an injury or a medical condition, can also cause a sudden spike. And sometimes underlying medical conditions like kidney disease, sleep apnea, or thyroid disorders can be the culprit. The most critical cause to be aware of is probably stress. It's something we all experience, but chronic stress can have a significant impact on your blood pressure. When you're stressed, your body's fight or flight response kicks in, causing your blood vessels to constrict and your heart rate to increase. This can lead to a rapid spike in blood pressure, which can be concerning if you're already at risk for heart disease. So, what can you do? Taking a few deep breaths, practicing relaxation techniques like meditation or yoga, and getting regular exercise can help mitigate stress's impact on your blood pressure. Sudden blood pressure spikes can be caused by a variety of factors, including stress, certain medications, caffeine, nicotine, acute pain, and underlying medical conditions. Understanding these triggers is key to managing your blood pressure and preventing potential health issues. If you're experiencing frequent spikes, make sure to consult with a doctor to get to the bottom of it. Share your story in the comments below. I'd love to hear about it. Don't forget to like this video and subscribe for more health content. If you're interested in learning more about managing stress, check out our related video on stress-reducing techniques. Thanks for watching.